Can I welcome everybody to this afternoon's Health and Wellbeing Board, the 19th of May 2021. Can I ask you, if you are not speaking, to please keep your camera turned off, and it's got something to do with widthband, and can you remain muted at all times unless you're speaking, please. Can I give you notice that this meeting will be recorded and it will be used for subsequent live or subsequent webcasts via the council's intranet site, and members of the press and public may record and take photographs, and the whole of the meeting will be filmed except for where there are confidential or exempt items, and today we haven't got any of those. Also, can I ask you, I've already asked you to switch off your mic and your video if you're not speaking, unless you're called in by myself, the chair. Can I ask, has anybody got any declaration of interest? If you have, can you let me know now, please? Right, complete silence. And Stacey, can you let me know if we've got any apologies for today's meeting?
Yes, Councillor Hamilton, there's apologies from Richard Kirby for today and Chief Superintendent Stephen Graham.
Right, that's fantastic. Thank you for that. Now, we've got the proposed dates of the meeting for the Birmingham Health and Wellbeing Board, and because we are now, any meetings we've got to do live, we've got to take decisions. The way the meeting is got to be run, we've got to do it live. So we've got to go to the council house until it closes, or we've got to find a subsequent site that we can use. If we're not taking any decisions, we can remain online. So Stacey, could I ask you to call out the dates of the meetings for this municipal year, please?
Just bear with me 1 minute, I need to open them unless Errol has them to hand.
Has anybody got them to hand? Can say it quickly, because I haven't, sorry. Can we come back to that then? Can I go straight on to minutes and matters arising from the last meeting? Brilliant. Going back to item 4, the dates of the next meeting. The next one is the 27th of July 2021, Tuesday the 21st of September 2021, and Tuesday the 30th of, let me get that date, Tuesday the 30th, Tuesday the 18th of, no, Tuesday the 30th of November 2021, and Tuesday the 18th of January 2022, and Tuesday the 22nd of March 2022. Can I ask you all to make sure those dates are in your diary, because unless there is something absolutely fundamentally gone monumentally wrong, those dates will be the dates we have the meetings. And also, if I'm not around for any reason, will my deputy, William, can I ask you to introduce yourself, please? He will be taking the meeting.
I am here. So yeah, hi, I'm Will Turner. I'm the chair of the Birmingham Solihull CCG and a GP locally.
Brilliant, Will, thank you. Thanks. And Elizabeth has helpfully put in the chat that the meetings will start at 3 o'clock. I know some of this will start to get a little bit confusing because some of it will be done online, some of it will be done in person, but we will give you plenty of notice when we've got to do something online. Right, let me move to minutes. Minutes of the last meeting and matters arising. To note minutes of the last meeting, are there any matters arising from the last minute? Again, silent. Okay, I will record that then as an accurate reflection of minutes from the last meeting. And can I move swiftly on to Stacey Gunther, who will go through the action log with us? Thank you. Stacey, over to you.
Thank you. I can just confirm that there aren't any outstanding actions on the Health and Wellbeing Board action log. Thank you.
That's great. Brilliant. Right, sorry, I'm a little bit perturbed today. I will get there. Now for the bit of the afternoon that you so look forward to, and that's my remark. Now this afternoon, I've got not an awful lot, but I will try and work my way through it quite quickly. Can I just say we've got good news, and Paul will talk about this in a moment. The vaccine rollout, which is just gathering momentum, and I'll be trying to do my bit, which I have been doing on the rollout, which I've started doing on a Friday and whenever they need me on a Saturday. And I'm also visiting quite a lot of sites, which I do enjoy doing. And I have found that really, really rewarding, actually. It's something that I've enjoyed doing. We've had the Queen's speech earlier in the month, and some of the snippets of the Queen's speech, it's been quite good news on funding being made available to support health and well-being, tackling obesity and improving mental health, which is much welcome, very much welcome. I have to say, some of the turnaround in which we've got to get this money, not just doled out, but spent, has been really, really quite quickly, the turnaround. But we've had the extra money, they've recognised the issues, and we have to say that is good news. However, it was disappointing to see that the promise and much needed urgent social care long-term funding solution was yet again missing from the Queen's speech. And the renewed commitment to social care reform is absolutely welcome, but it would have been great to understand when our Prime Minister will set out when he will fix social care, which is boldly pledged to do at his election victory in 2019, and we're still awaiting what is going to happen in this area. It is worrying, as a survey of Age UK found, the pandemic had significantly increased older people's social care needs, with nearly a quarter, which was 23% of those 60 and over, saying their ability to carry out everyday activities had worsened since the first lockdown. And we all understand the immense strain COVID has created on our health and social care sector, which desperately needs strengthening. With lockdown easing, we are beginning to open up, and our day centres and daycare homes are opening to visitors, which is crucial for us all. Social isolation is something that we need to look at, and it does need to be addressed. I'm going to say here, Justin will say in his speech, although things are going to open up, we still do need to be careful. We still do need to be wary because of the variants that are swirling around out there. This morning, I attended a meeting to discuss mental health prevention and promotion, and the additional funds will help in supporting our communities and affected by mental health, which continues to emerge as a key issue. At the LGA Community Wellbeing meeting last week, we looked at the dementia strategy between 2021 and 2041, updating the LGA alongside the Alzheimer's Society will oversee the strategy as the Dementia Programme Board continues. It will be a 3-year strategy, and it is proposed that year 1 will be focused on the COVID recovery and issues arising from the pandemic. Years 2 and 3 will look at issues agreed by the Dementia Programme Board prior to the pandemic. Councils have a key role to play delivering commissioning services for people with dementia in the community, and the strategy will need to reflect the diverse needs of our communities, particularly around raising awareness, risk reduction, and ensuring appropriate concern, and also reducing stigma in these areas. Infant mortality. Last month at full council, I responded to a task and finish review of infant mortality, and I've asked for this to be discussed at the Health and Wellbeing Board soon. It was a very, very hard read. We need to do more. The preventative loss of life of a baby is the most devastating consequence any family could ever face. And the fact that in Birmingham, our rates are so high is distressing, and it does make uncomfortable reading. I am committed to doing all I can to reverse this. The report highlights that some of these deaths are preventable through a range of earlier actions and awareness and earlier conversations on lifestyle choices prior to conception and during pregnancy. There is more we need to collectively undertake together with our health partners, our communities, and with our citizens. Can I just add, we have, at the moment, we are going to be looking for a chair to chair that task force. And we're looking for someone that has got the passion, the drive to really, you know, we've got officers who will do the work, but we will be looking for somebody to chair that task force. I didn't particularly want a politician. I didn't want somebody that had got their head buried in the services. I wanted somebody that could give it the overview that it needed and the push that it needed, because Birmingham City Council and the City of Birmingham takes this issue seriously, and we do intend to ensure that the outcomes are met in this area. And on that note, I also wanted to quickly just say thank you to everybody for listening to me ramble on about my verbal report, and I will move on to the next item on the agenda. Unfortunately, this week we've got no public questions this month, so I've got no questions that we need to answer. So I will swiftly move on to Dr. Justin Varney, who will give us the COVID-19 position statement for this month. Justin, over to you. Thank you.
Thank you, Councillor Hamilton. And as we have a local outbreak engagement board next week, I will not be doing the full slide set that I would at a board when there's a longer distance of time between now and the local outbreak engagement board, but I will give some overview comments about the direction of travel. So we are seeing case numbers in Birmingham continue to decline, which is really good news. And reflects all the hard work of citizens and partners working together to bring the COVID outbreak under control. However, we are not out of the woods yet, and if you look to the north to areas like Bolton and Blackburn and Darwin, the rapid escalation of the what's now called the April variant, previously known as the Indian variant, has led to rapid increase in case rates, and unfortunately now that is starting to translate into hospitalisations amongst predominantly people who have had no vaccine or only one dose of the vaccine. And that is a caution to us all. In Birmingham at the moment we are seeing still a relatively small number of variants of concern of any type, but we are now starting to get through data from Public Health England, and we will give a fuller presentation on variants of concern next week. But of those that we're aware of that are the April variant of concern, in total up to the 14th of May, we've only had 29 cases in the city, and of those where the contact tracing has been completed, over half are either directly travellers themselves or live and are direct contacts with someone who's come from overseas. So what we're not seeing in Birmingham is a significant number of cases in the community where there's no history of travel. Colleagues will be aware we have in recent weeks run 3 Operation Eagles. Those were around cases of the South African variant, where we again identified individuals that weren't linked to travel, and we've done surge testing to try and see if there's any different pattern or any evidence of more spread in the community. And as far those operations have not identified any further cases of new variants, although they did find a small number of additional cases of people who were positive and didn't know it. So that it's always a benefit when we do this surge testing that we find potentially more cases and we can further reduce the transmission of the virus across the city. We have been preparing and we've been running some scenario exercises around what might happen if we saw escalation in the similar picture to what we've seen in Bolton. And at next week's Local Outbreak Engagement Board, there will be a fuller presentation on the learning from the Operation Eagles, but also some of the work that we're doing around preparing for various scenarios looking to the future. It is important to remind everyone that COVID remains a risk, and it's important that we continue to follow the guidance, maintaining hands, face and space, and now adding in ventilate. As the weather has got better and we've learnt more about the virus, it becomes more important that we keep windows open, particularly when we're in environments with people that we don't live with. So if you are having people over, under that rule of up to 6 people from different households or 2 households coming together indoors, please make sure you keep the windows open and keep the rooms well ventilated. Maintain distance and keep washing your hands, because the lessons from Bolton and from Blackburn show us that these numbers can escalate very quickly, and that the new April variant does present a serious risk, particularly because the evidence emerging is that it is more infectious than the Kent variant we had at the beginning of the year. It may or may not be more dangerous in terms of putting more people into hospital, but simply the fact that it is more infectious means more people will become infected. And even if the same proportion end up in hospital, that means more pressure on the NHS. And that brings me to the final point to reiterate the importance of getting vaccinated. All of the evidence currently internationally shows that the vaccines that we are using in the UK are effective against the new variants and do reduce the risk of hospitalisation and significantly reduce the risk of dying. And the situation that we're seeing from Bolton, the vast majority of people who've been admitted to hospital are people who were in the priority groups, were eligible for vaccine and had chosen or been unable to take up the vaccine. And sadly, as this wave swept through Bolton, they then succumbed and ended up in hospital, and sadly some of them have died. A small number of them have had the first dose but not the second dose. And there's one case in an extremely frail individual who did have 2 doses and still became extremely unwell. But it reinforces, I think, for everyone, the importance, if you are in those priority eligible groups, particularly individuals who are considered clinically extremely vulnerable, those who were shielded, or those that are considered clinically at risk. So those people in general who had the flu jab in a normal year, those are the people that I think should be taking the extra steps to make sure they get their vaccine now, because we really want to close that gap and get those vaccines into you as soon as possible before we see that wave of the new April variant moving down across the country. So there is still a way to go, and I think we will still see these challenges around new variants appearing over the next year, but we are in a good place. We have been doing everything that's asked for us, and we have to keep going at it to avoid ending up in the situation that other areas in the country currently find themselves in there. I'll finish there, Councillor Hamilton. I know I think Paul Jennings is going to talk a bit about vaccination, but I'm happy to take any questions from the board.
Right, what I'll do, I'll combine both. Paul, if you could speak a little bit about the vaccine and the rollout, and then I'll ask Pip or Dr. Munir to come in after. Then any questions after that point. Thank you.
Thank you, Councillor Hamilton. I agree with everything that Justin said, except his view of the weather. I still think it's not that good, but I've got my window open, just to be pleased to know, even though I'm here on my own. The vaccine rollout continues. We continue to go gently down through the age groups. We're, as you know, administering now the Pfizer vaccine to individuals aged under 40. The supply of vaccine is coming through to allow us to meet all of our second dose obligations, whether they're Pfizer or AZ vaccine, and probably over this week and early next week, we will reach the point where we will have administered 1 million vaccines across Birmingham and Solihull, around 3/4 of those through primary care, and 1/4 through the mass sites and the hospital hubs, which I think is an astonishing achievement. Just to re-emphasise what Justin said as well, no one gets left behind on this. So if at any point you've chosen not to have the vaccine, or you didn't feel you could for whatever reason, if at any point you change your mind, you will be warmly welcomed in to have your vaccine and to join those who are taking on a level of protection which looks like it works against pretty well all of the versions of the virus that we currently have in circulation. It's been a fantastic and mammoth effort, and people have been going hard at this now since we started just before the new year. So we've been at it now for just over 5 months. In line with what Justin was saying, we are also planning for any potential surge. So you'll know that in Bolton you'll have seen the buses with people queuing up to have the vaccine. Most of those actually were people who could have had it before and didn't. But we will have plans in place. We have a fantastic capacity for vaccines here. Working flat out, we know that we could do about 120,000 a week. We've never had that level of supply. So if we do find ourselves in a surge situation, I'm reasonably confident that we have the resources, the skill, the planning capability, the competencies, and most importantly, a committed workforce, many of whom, of course, are volunteers that will enable us to deliver what's required should it be needed. But for the meantime, we carry on with the vaccine programme as it stands. We work through the cohorts, and hopefully we get to the point sometime around this summer where every single adult will have been offered the opportunity to be vaccine protected before we move on into, we haven't had the summer yet, but we started to plan for our winter, for our flu programs and our COVID vaccine booster program that looks like we'll be doing later this year as well. Thank you, Councillor Hamilton.
That's fantastic, Paul. Is Pip here or Dr. Munir? Dr. Munir, over to you. Would you like to give the feedback for West Birmingham, please?
I think we're both here, Councillor Hamilton, and whilst I would echo that we've done really well, and delivering 1 million vaccines is much more than we could ever have hoped for, actually. I think there is still a challenge, and I think Justin pointed to it, that in Bolton, those people that are not vaccinated are suffering. So the infections are spreading quickly amongst those people, and a significant portion of those people are becoming unwell. In West Birmingham, I think, compared to the rest of the Black Country, we are still 10% behind on vaccination rates in most of the priority cohorts. And although we've got lots of things in place, including revamping our community pharmacy offer, making vaccine available in practices, continuing the work that we've done at the city site that will extend now into the winter period, autumn and winter period, to continue to deliver large-scale vaccination, and the vaccination sites at Aston Villa and Millennium Point. We still have a challenge here. Our system is at risk of COVID spreading quickly within our communities, and we do have a significant portion of people that are not vaccinated. So while I'm excited that we've got this far, and I think it's much better than we've ever done with the flu campaign previously, there's more for us to do, and we'll continue to do that work as Paul described. If you've given up the opportunity to have your vaccine on one occasion, that's okay. If you change your mind, we are here. We've got the access points for you to come and get vaccinated.
Pip, do you want to add to that? Right, well, could I ask a question, as no one else seems to be asking? What innovative ways have you been trying to work with communities to get, not so much to get them to take the vaccine, but to make it far more accessible for communities?
We've had a mobile vaccine sites, you know, the bands that go around. We've been working through and with faith groups and community groups. We've been offering vaccine sessions where specific languages are spoken. We've proliferated more sites into pharmacies, because those also can be more local areas that are locally trusted by individuals. We had, I know, in the first 3 months of the campaign, we had nearly 80 engagement meetings with communities and leaders and so on. And I know that pattern is very much reflected in the west of the city as well.
Fantastic. What about yourselves over in the west of the city?
So I think
exactly the same approach, actually. I think the approach that Paul set out there has crossed the whole of Birmingham, rather than being something that's done differently in the two patches. Probably one additional specific to add as well, which I know has happened across the whole of Birmingham. We've done quite a lot of work with the voluntary and community sector, as well as the faith-based organisations, and have provided some additional support or capacity to some of our voluntary sector organisations to get them to link with the communities that they serve as well, to help us to spread the message. And we've had some real wins through doing that by getting the voluntary and community sector and the faith-based organisations to help us with the booking of vaccination slots for communities. So it's been really targeted work, I think, identifying individuals with the help of the public health teams who haven't come forward yet, and then having that really relentless approach to offer vaccination slots in as many ways, as many times, in as many places as possible.
How has it worked with communities? I forgot my train of thought. You know, when you've got large families like mine, I'll just say I'm in a large household. How has that worked, going in and vaccinating the whole family? How many have you been able to get to a lot of those families?
I was going to come back, actually, that's why I had my hand up, because I'd forgotten that one. It was one of the first ones we did. Birmingham, and that's the whole of Birmingham. We were the first area in the country. It was our proposition to be allowed to vaccinate multiple generations in a household. And we had to struggle quite hard to get permission to do that, but we were the first, and quite a few have followed on. I heard some of them name check the Today programme. I was a bit disappointed that they didn't name check us, but there you go. Sometimes you don't get the fame you deserve, do you? And the other thing that I think, I mean, you know, that Mania's not said, but I'll say it for him, is that many of the GPs have spent absolutely hours on this individually, one-to-one conversations with patients or with families to you know, make the case, make the argument, persuade people to you know, encourage them and so on. The doctors have really done sterling work.
Yeah, I have to be honest, the system has done a phenomenal job. And as somebody that has started to go back in and not just supported the vaccine rollout, but been able to visit some of the sites, I have been truly impressed at the military operation to get people through. I remember when I did a shift the other week, I went in and I started, and by the end of the night, I was exhausted, but it was exhilarating. When you see the amount of people you get done in an afternoon, it's military, it's excellent, to be honest. I'm really impressed. Now, I'm going to bring Stephen Raybould in. So while he puts his camera on, I'm going to read out what Robin Miller has said, Professor Miller has said, because Robin has highlighted that it's an incredible achievement, Paul, that you're getting to your millionth dose. And how are you going to publicly not just let people know, but celebrate this?
We have a plan.
Oh, they have a plan. They're not telling us. Okay, I'll move swiftly on to Stephen. Stephen, over to you.
Just to say, I think that there's been a very interesting piece of work in West Birmingham where the PCNs have partnered with voluntary sector organisations, and they've managed to boost the uptake the vaccine in communities around Lozells, and I think that we were looking at how we could expand that further across West Birmingham. I think that's been really positive. I had a question really, which was around the population resilience, and as a comparison to Bolton, and whether we're in a similar position in relation to vaccines or in a different position. I don't know whether Justin or Paul or Munir or Pip would be able to come back on that.
Well, just very quickly, our penetration's been pretty strong. It's the most impressive we've ever had in terms of our local population, even for flu, for instance. But the shape of our populations are different. As we famously say, Birmingham is the youngest city in Western Europe, so there'll be issues as we move down. That we've still got a long way to go in terms of numbers. So we've come down from like people who are 106 down to 37, but there are a lot more people below 37 that we need to get to, and I think that's probably one of the key issues. The other, just to mention in passing, of course, is what incredible work. And the second time I've name checked the GPs, but the GPs are still with us on this programme. In Bolton, the GPs withdrew from vaccination programme, I understand, a few weeks ago. So when you see the buses on the telly, the buses is what they've got. They haven't got the primary care function going there the way that we have.
Dr. Munir, thank you. Dr. Munir, you wanted to come back?
Yeah, it was just to highlight Stephen's point. We'll spend quite a lot of time in this meeting talking about integrated care partnerships and integrated care systems. And actually, I think what's really important not to get lost is that when we work in partnership, we achieve great things. And working with Healthwatch, the voluntary sector, community pharmacy, working with our colleagues in mass vaccination sites and hospital sites, and across the 70% of vaccinations that have been delivered in general practice. When we work in partnership, we achieve absolutely fantastic things. And I think it really shouldn't be lost when we have the conversation about integrated care systems and partnerships, that actually this is what we're trying to achieve.
Thank you, Dr. Munir. Can I bring Dr. Varney back in? Because Justin, you made a comment, I can't see other areas, detailed vaccination data, only Birmingham's. What do you mean by that, Justin? Just so that we're absolutely clear.
Sure. So I have access to about 3 different websites I have to log into to look at the vaccine data, some of which Paul, Pip and Munir have access to, and some I've got a different one that kind of just displays the data in a different way. But the access to that is restricted to the information about Birmingham residents and the 2 SDP ICS NHS systems that we work with. So I can see the data for Birmingham Solihull, and I can see the data for West Birmingham, Sandwell and the rest of the Black Country, but I don't have access to the Bolton data to be able to look at is their vaccination uptake particularly different from ours in terms of were less of their at-risk vaccinated than where we are currently at the moment. So I can't do that kind of analysis, which I think is what Stephen was hinting at, was where we look at the uptake, we're doing really well. We still have some communities that we'd really like to change their minds and come back. There is no blame, no judgment here. The reality is that the April variant is posing a very, very real threat now. So if you're watching the news, the pictures from India, and you've thought about it and gone, actually, no, I am ready to have the vaccine, please get in contact with the NHS, book through the NHS website, or if you have a medical condition, you want to talk it through, please talk to your pharmacist or to your GP practice about your personal circumstances. But I can't see the detail of Bolton to be able to go, we're in a very different position or we're in a similar position. Certainly in terms of the demographic of our population, we're not that dissimilar from Blackburn and Darwin, which is also seeing an uplift. Bolton, I think, is slightly less diverse in the way that we are, and is slightly older, but we're not radically different. If this was happening, for example, in Devon, I would be perhaps less concerned than I am about it happening in Greater Manchester.
Thank you for that, Justin. Really appreciate the explanation. And can I thank Paul Jennings, can I thank Dr. Munir, and can I thank Pip for giving us that very full feedback. It's been, can I just thank you all for all your hard work, because it has not been easy out there over the last 6 months, but you guys have made it look easy and it really isn't. So thank you for all your hard work and dedication, and we'll do the same again next time we get together. So I'm going to move swiftly on to the next item, and the next item, sorry, I'm reading off another screen. The next item is integration and innovation working together to improve health and social care for all. Now, we've got 4 separate parts to this. So what I'm going to do is I'm going to bring Aidan Hall in, who will talk about the white paper. I'm then going to bring Doug Simpkins in, who will talk about inequalities. I will then bring Paul Jennings. I'm not sure who's doing your item, Paul. I don't know if it's Rachel, and Dr. Manier to talk about STP ICSs, and Rachel is doing transitions. So let me start with Aidan, because we can't do this again, but it's 4 separate items under this one section. So Aidan, it's Aidan's first time, so be good to him. So Aidan, I'm going to ask you, be succinct, get the key points across, but people should have read the document, so you don't have to go through the whole thing again. Is that okay?
That's great. Thank you, Councillor.
All right. Thank you then, Aidan. Over to you. You've got 5 minutes or just over.
Okay, thank you. Hi, everyone. So I'm Aidan Hall from the City Council's Public Health team. I'm just going to provide a quick 5-minute overview of the government's Health and Social Care White Paper published back in February of this year. I'll focus the overview submitted to the board on the legislative proposals as they are outlined in the white paper. The board is asked to note the report and offer their commitment to work with partners in the system. So the white paper builds on the recommendations made by NHS England and NHS Improvement in December of last year and supports the NHS long-term plan. The proposals are a move towards collaboration and integration over competition, and the legislation has also tried to avoid a one-size-fits-all approach and allows local systems to lead. First section is working together to support integration, and at the centre of what is proposed is establishing integrated care systems, or ICSs, on a statutory footing. So the white paper sets out this dual structure of an ICS NHS body and an ICS health and care partnership, and together these are referred to as the ICS. The ICS NHS body will be responsible for strategic planning, decisions involving allocation, and responsible for the day-to-day running of the ICS. The ICS Health and Care Partnership will develop a broader plan to address the system's health, public health and social care needs. The ICS NHS body and the local authority will have regard to this plan produced by the Health and Care Partnership. Other measures to support integration include a duty to collaborate, proposals to facilitate collaborative commissioning, and legislation to enable decisions to be taken by joint committees. There are also other provisions to allow NHS bodies to make joint appointments and proposals to ensure data sharing as well. So the second theme is reducing bureaucracy, and this one contains several proposals that relate to competition and specifically reducing it, as well as arrangements for commissioning and providing healthcare services. The third theme is improving accountability and enhancing public confidence. And this includes the aim to bring together NHS England and NHS Improvement. And with that, bringing those two together, it sets out what it calls appropriate and structured powers of direction given to the Secretary of State for Health and Social Care, as well as additional powers for them involving reconfigurations and arm's length bodies. There are also changes to the frequency to publishing the NHS mandate and a new duty on the Secretary of State to publish a report every Parliament that sets out the roles and responsibilities for workforce planning and supply, and that's for health and social care. The final thing is additional proposals which are more targeted on social care, public health and safety and quality. For social care, the bill will introduce a new duty for the Care Quality Commission, CQC, to assess local authorities' delivery of their adult social care duties and improve the quality and availability of data. Again, legislation will expand the powers of the Secretary of State so they can make direct payments to any bodies engaged in the provision of social care services. And the white paper updates the approach to hospital discharge to enable a discharge to assess model. For public health, there are measures to give the Secretary of State the power to direct NHS England to take on specific public health functions and proposals that relate to the government's obesity strategy. The white paper states that the Health and Wellbeing Board will remain in place and continue to have an important responsibility at place level to bring partners together. The paper refers to Health and Wellbeing Board's experience as place-based planners. ICSs are expected to work closely with Health and Wellbeing Boards and have regard to the Joint Strategic Needs Assessments, so our JSNA, and Joint Health and Wellbeing Board strategies in the areas they cover. The white paper states that the government will support Health and Wellbeing Boards and ICSs with guidance on how to work together, how to complement each other's roles, and to share learning and expertise. You mentioned earlier the Queen's speech last week, and with that they announced the Health and Care Bill, which will be brought forward. Also published last week, if members of the board are interested, was the report by the Government's Health and Social Care Committee following the inquiry into the white paper. The report is supportive of the proposals but does set out areas that require further clarity. So following the Queen's speech last week, the bill is expected to be introduced early in the new parliamentary session, so that measures can start to be implemented in 2022. And it's my understanding that systems will be expected to operate in a shadow form from September of this year, 2021. So that's a very kind of quick 5-minute overview. I hope I get to the time, but I'll leave it there. Thank you.
You've done an excellent job, Aidan. What I would ask people, if you could store up your question. If someone's got the odd question, I don't mind taking it. Otherwise, we'll go straight over to Doug, who, are you all right, Doug? He will do the next item, and your item is around inequalities. Yes, Doug? Have I got that right?
You've got that right, Councillor. So I'm presenting this on behalf of Richard Kirby, who's the lead for the ICS inequalities work, and he brought that paper to this board, or the development of that programme of work to this board previously. So I'm updating where we've got to. So we have actually established the inequalities work programme and had our first board meeting. We've welcomed Salma Yacoub as our inequalities programme lead, and we've agreed a couple of guiding principles. First, reducing health inequalities and workforce inequalities is a mainstream activity core to, not peripheral to, what we're doing in the NHS, and interventions to address inequalities must be evidence-based. And they must be measurable. We've also identified 3 priorities which will drive 8 work streams, and those are on your paper. The 8 work streams sometimes appear to be 9, and in the appendix at the end of the paper, I think we have got 1, 2, 3, 4, 5, 6, 7. No, there are 8 there. They're described, but we are morphing those. And I wanted to come back to what you said about infant mortality, Councillor, because we want to make that one of our key prevention work streams. So while we've got in prevention at the end of the paper maternity pathways and early years pathways, actually we think a key programme is our contribution to what we can do to reduce infant mortality. When I read the Creating a Healthier City Strategy 2022 to 2030, I really think this does link together, and we are challenging ourselves as the NHS not only to think about inequalities in terms of issues of access and issues of promoting healthy behaviour, though those are both really important issues, but also to think about all 6 of the Marmot principles which are highlighted in the Healthier City Strategy, and how we as the NHS contribute to all 6 of those Marmot priority areas. I'm happy to take questions when the time arises.
Thank you for that, Doug. Really appreciated. Now, the third persons, and if I've got this wrong, Stacey, I'll need you to jump in right now, will be Paul and then I think Dr. Munir or Pip talking about the transition, I think, from STPs to ICSs. Have I got that right?
Yes, Councillor, of course.
Fantastic.
You're always right. You're always right, whatever you say.
Oh, you do know to say the right things, Paul. Over to you.
What I would like to do, if I just very briefly say a couple of things, is to bring Javier in to say something about how we try to turn this ICS into a thing we do rather than a thing we talk about. So I'm going to assume that people have read the papers. The heart of it for me is if you have a moment to look at the pack, is actually what's on page 58. On page 58, there is the outline of the 4 things that the ICS is fundamentally here to do: improving population health, tackling inequality in outcome and access, enhancing productivity and value, and supporting the broader social and economic development. And as Munir said earlier, the last 15 months or so has been a kind of a worked example of how that can work and how it has worked, and how we've taken down a lot of our organisational and institutional boundaries and borders between ourselves to provide a more effective response to COVID. As you said yourself earlier, Councillor Hamilton, the impact of COVID is going to be with us for some years to come. An economic impact where we see, you know, youth unemployment again at a very high level, sadly, in this city. A mental health impact. We know that there is a direct correlation between employment, worklessness, and mental health referrals. We're going to see, we've already seen a massive increase in mental health referrals amongst children and young people, which undoubtedly has been linked to this period of lockdown. So tackling all of that will only be tackled effectively if we do it together in a coordinated and effective way. And that's why this partnership that we work so hard to build and treasure, particularly with local government, is really absolutely the heart of what we're trying to do in terms of making our ICS a real thing that does stuff, rather than something that keeps revising and polishing its strategy. If I may, Councillor, I'll just pass to Javier to just make a few comments on the plan, as it were.
Okay, thank you, Paul.
Succinct, please, Javier.
I'll be succinct, yes. So I'm here to I'm attending the meeting as part of our engagement process for the development of our BSOL operational plan for 21-22. You will have had a slide pack which contains the detail of the plan. I'm not proposing to go through that today, but it's there for your consideration and reference, and to feed back any comments you might have to me. But what I wanted to take you through is for you as stakeholders and our public to really understand the key headline messages of what we're trying to achieve, and really distill it into some key priorities for the system, some of which have already been talked about by other leads so far, so it should chime with what you've been discussing so far. As you've already said, 21-22 is very much a transitional year as we form ourselves as an ICS, but we're all still dealing with the kind of significant impact that COVID has had on our health and care system. But we really want to kind of tackle our challenges and be really clear about how we're recovering our services and taking steps forward to deliver better outcomes and improved health and well-being for our citizens. So what I wanted to share with you as part of this engagement is a piece of work that has come out of an initial discussion within the system at the chief exec level around our 3 to 5 year strategic goals as an ICS, which are informed by things like the JSNA, our long-term plan, our outcomes framework, etc. But more specifically, what I just wanted to show you on the screen were 8 key areas that have been proposed in terms of our ICS priorities for this year. So we're really clear around what we want to deliver, and we can be really clear with our public as well around our priorities. If you give me 1 second, I just want to share one slide with you so you can see what those 8 priorities are. So let me know if that they've come up on screen. Can you all see that?
They have RVS.
Okay,
Yeah.
okay. So these are eight specific areas, and kind of at a headline level, one of our key priorities that we're proposing is around keeping our citizens and our staff and colleagues COVID safe. We're also wanting to look at staff wellbeing, and that's also taking account of equality and diversity within that work programme as well. We've got a big challenge around tackling our waiting times, and that is across urgent and emergency care, as well as our elective backlogs that are built up over the COVID period. We're also wanting to roll out and really focus on early help and early intervention. So this is really about the kind of life courses from sort of kind of the born well life cycle through to kind of end of life care, but also incorporates our mental health services as well. There's going to be a focus on improving prevention and also the health of people living with long-term conditions as well, and that will include people with disabilities, for example. So we're really looking across that golden thread around inequalities as well. As our sixth priority, we're proposing transforming access to care, really focusing on our digitally driven care pathways. Seventh item is around creating local jobs for local people as anchor institutions, and a very significant eighth priority around our ICS development. And we've got a lot of work to do this year, particularly over the next 6 to 12 months, around forming ourselves as a statutory ICS for the in time for the 1st of April deadline next year. So what I just wanted to do was get your views, and that can be offline, or I can take a couple of questions now around your views on whether we kind of hit the mark with those priorities, and do they sort of chime with the challenges and issues that we face as a system. And we really wanted to use that as the sort of front end of our operational plan. We'll do a bit more work in terms of distilling those into kind of outcomes and deliverables, so we're really clear what we have to achieve, and we can track and report on progress against those as well. I'll keep them up on the screen so people can continue to sort of see that list, but happy to take any questions if anybody's got any.
Right, Arvia, we've got West Birmingham who will be speaking next through Pip, so you can put them back up in a minute, but
okay.
Just allow Pip, or is it Mania? I really am sorry, I'm not speaking. Pip, if you'd like do the West Birmingham point, please.
Yeah, no, that's fine. Thank you, Councillor Hamilton. I think one of the additional components that's there for us in terms of our journey towards becoming an ICS is that we know that integrated care works best when NHS services are well integrated with local authority services. That's been well proven through the work that we've done so far. I think in the white paper and the guidance that accompanies that, there's a clear expectation set out that CCG boundaries and local authority boundaries become aligned to support that integration. And we know that currently West Birmingham sits in a different CCG system to the rest of Birmingham with BSOL. So I think there's a challenge on us as system leaders to work over the coming year to see how we resolve that for the benefit of local people. Now, at the moment, we're working closely across with Paul's team in BSOL to set out what that might mean for us and what our journey might be. And I think it's something that it might be useful for us to bring back in a bit more detail at a subsequent meeting. But just to highlight the fact that I think we're on a trajectory to bring the health economies back together over Birmingham for the benefit of integrated care.
That's excellent. Before I bring Rachel in, I do think it's important that we covered the first 3 areas. So are there any questions? None at all?
Justin has his hand up.
Who's got their hand up? Is that Justin?
Yes, Councillor Hamilton.
Go on then, Justin. Let's see if you ask the question I'm going to ask.
So I think really question around, given what Pip said, which I strongly welcome, and I think as Paul and Manu have both alluded to, actually the way that West Birmingham has worked collegiately with BSOL through this has really demonstrated, and I think really changed a lot of the dynamics that we have around how we really deliver to the citizens of Birmingham effectively as a whole city, which is really positive. In Javia's presentation, my ask was, have those priorities gone through the West Birmingham ICP, the Integrated Care Partnership, as part of the pre-journey before they come to the board? Because one of the key bits that I certainly would want to see is that West Birmingham are supportive of them. And then the second thing is, in terms of the request for members to feed back on those 8, suggest, Harvey, we do that electronically so that you get a more detailed and thought through approach to them.
Right. I do agree with what I'm going to bring you in a minute, Pip, but I do agree with what Justin said, but it would be good for the sake of the board if we could get a few comments on the points that Arvia raised, also on the bits that were raised by Pip. It's really important around the systems. So I would like to hear a few of the points highlighted this afternoon, because I am concerned that as a health and wellbeing board, I'll start with Aidan's contribution. He really laid it out well around the white paper and our role in the white paper. I'm very clear that as a health and wellbeing board, if we are going to play a really significant role going forward, we have to have some very strong and positive or negative views. I'm not overly bothered, so that as the ICS is developing, that they see us as a board that actually has bite, if that makes sense. So I do think what Aidan said was really important. Read the journey that white paper is going through. Read Arvia's 8 points. I think that was really key, because the chief execs have gone away and they've identified 8 areas. Now, I'm not hearing anything from people like Professor Robin Miller. I'm not hearing anything from primary care. I'm not hearing anything from the voluntary sector. Are you guys saying that you absolutely support what the chief execs have said are their key areas going forward? I agree with Justin, we have to write some of it down. But initially, what are your views? Re what Arvia has said. And then secondly, Pip has dropped a bombshell on us, because she's finally said publicly what a lot of us know privately, that at the moment, West Birmingham isn't in the Birmingham system. So there's lots of work to be done in the next year, where West Birmingham will sit. What are people saying on this board? So I'm throwing the challenge back. What are people saying on this board? And what I'm asking of you is, they've made some powerful statements this afternoon. So what I'm going to do is, if people are not raising hands, I am going to call you in, because it is important that we hear from some of the key players around the system, because this is just for noting, but it's really important that we start to get a feel of what people are saying. So I'm going to go over to Robin first, because he's put his camera on, so he's set himself up for it.
Thank you for that. That will teach me. I mean, look, I genuinely think that these sort of aspirations have been set out today, and we obviously heard about on the away day that we had a couple of weeks ago, are really really inspirational, actually. And I think what's really great to see is a healthcare service that's totally embraced the kind of notion of general well-being, inequalities, and are trying to work in a more community orientated and social care friendly way. So I genuinely come to this, Paulette, as someone who's incredibly reassured, I think, by the plans for this ICS, and I think the fact it builds on the previous relationship that was established with the Health and Wellbeing Board just underlines that. I think in terms of the West Birmingham question, I think it's always hard, to be honest, as a more independent observer, to comment on that, because we know there's so many complicated discussions that are ongoing with that. It's hard to kind of provide any meaningful insight. I mean, it obviously is complicated. There's a natural tendency to wish to the same boundary, and the city boundary is the one that most people work to, most people live in. But it's very hard as a kind of external commentator to note that. The one thing I would like to bring up, and it may not be the point to bring up now, is that all of what we're talking about here will require our workforce to behave differently. And obviously two key elements here. One is in terms of their ability to collaborate, and their other is their ability to work with communities. And that's not unfamiliar to them, but I think what we're saying is we want to see a step change up in the way they do that. And I guess I was wondering, partly because of my role, is what's your engagement like with universities? Do you feel they understand what's required of the future health and social care professionals, and are they providing the right professional development support for you? And this may not be the time to discuss that, but what I would say is perhaps let's come back to a future board meeting if it's not the time now.
Excellent point, Robin. I was wondering when you were going to bring that up, because I'm thinking that myself. We've not heard a great deal from our university players, and they are absolutely key. So let me go over to some of the some people who have put their hand up to speak. Can I start with Stephen, please? Stephen Raybould. Then I'll go to Dr. Munir, and Andy Cave will be the third person. Stephen, over to you.
So just to say, we'll come back on the priorities with the digital consultation. In relation to West Birmingham, I think it's important that in lots of ways, West Birmingham is in the Birmingham system. It's just the challenge is that we have two systems, and that doesn't really work for citizens. If the direction is towards merger, I think the primary experience for the people who are anxious about it and who are concerned about what that might mean is that that is experienced as a merger rather than a takeover, and the absorption of West Birmingham into the BSOL system. There's lots that's brilliant, and I would really focus on this. The relationship to the voluntary sector in West Birmingham has historically been excellent, and I think we would very much like to see that carried into the wider space.
Thank you, Stephen. Excellent point. Can I go over to Dr. Munir, please?
Yeah, thank you, Councillor Hamilton. I have a few hats, but one of my hats is, well, I'm a Birmingham resident actually, so maybe I have three or four different hats. I'm a Birmingham resident. I'm a GP in West Birmingham, so my population serves Ladywood, which is some of the most deprived areas in the country. I make no apologies for arguing for those people to have better outcomes than they have at the moment. Zero apologies. And the idea that we manage health inequalities as their primary driver is exactly what my work is about, and that's what I would like the work of the Health and Wellbeing Board to be about as well. And I think it's really important that we listen to local people, that we allow decisions to be made locally that can be implemented, or that those decisions are enacted as close to the point where those decisions are made as possible. And so I think localism is really important here. The best work that we've done through COVID has been when we've engaged with communities. You know, when GPs have contacted patients about vaccinations, they've done okay. When communities have contacted each other about vaccinations, they've done fantastically well. So we just need to bear that in mind, that Ladywood has suffered from poor health and social inequalities for some time. Your area, the area that you serve, Councillor Hamilton, the area that I serve as a GP, has really suffered over the years. And despite it being in our in the legislation that we manage health inequalities, they've got worse over the last 10 years. So there's something that we need to do together differently to change the outcome. And I think that's a really important point to make here, is that we've tried and we didn't get there. We have to try again, but this time it can't be about what are you doing and what am I doing. It has to be about what we are doing together to achieve those aims. And actually we need to hold ourselves to account in 5 years, 10 years time to say, did we set ourselves a set of outcomes that we achieved? And if not, why not? Because actually, if we're all pulling in the same direction, there's no reason why we can't make the life lives a lot better for those people that live in West Birmingham. So in a sense, it doesn't matter to me which system we are in. What matters is that the work that we do for the people in West Birmingham is beneficial for them and it achieves the outcomes that we set.
Thank you, Dr. Munir. Can I move straight on to Andy? Andy Kay?
Thank you, Councillor Hamilton.
My pleasure.
I'll talk about the two aspects. First of all, kind of the priorities for the ICS, and then talk about West Birmingham, as you mentioned. So the first thing, I think one of the challenges is for the Health and Wellbeing Board that actually at this moment in time, we've all got different levels of involvement in the ICS process and different levels of understanding. So as an organisation that currently isn't in the BSOL ICS conversations, actually I'd really welcome further in-depth conversations about our role, our function, and actually how patients and the public are influencing these priorities, especially when we get into the finer detail of that, and how we can work at a locality level within the place of Birmingham and overcome some of the challenges of that. In terms of West Birmingham, actually, I think there's a lot that we can learn from West Birmingham and the Integrated Care Partnership across all localities of Birmingham. So actually, I really welcome the conversations of learning from the ICP in West Birmingham and how we can move that model and learn from it for the other localities as well, because there is real involvement from a Health Watch perspective in Black Country and West Birmingham, both at an ICP level in West Birmingham, but we also have representation at a board level as well in the Black Country. So yeah, I think just how we learn to increase involvement with all of the board members is really important.
That's a really important point, because I think what the voluntary sector on this board are trying to say, Arvia, is they need a voice. They need a voice at a higher level. They appreciate what's happening. They appreciate all the wonderful work that's gone on. But if I say it in Paulette speak, they need a voice. I will make one other point, but before I do that, is there anybody here from the Children's Trust? I can't see on the, is Kate or Andy? Andy, brilliant. Andy Coldrick. Is there anything that you want to add to the party before I make my point?
Thank you, Councillor. I had my hand up as a preemptive strike for fear that you would invite me in. So I guess I wanted to comment on a couple of Robin's points. On his last point, yes, there is much more that we ought to be able to do together to improve the offer that social work students receive to prepare them for practice, and we in the Trust will be very keen to work on that with the universities, including Birmingham. On the wider point about children, I guess what's key for me is that we remember that our focus in terms of early help and early intervention doesn't just mean early years. It doesn't just mean the first 1,001 days. It doesn't just mean school readiness. It means the earliest point in the beginnings of problems emerging for children, young people and families, whether they're 5 weeks old or 15. And the second point I'd make is it's only going to work. Robin was absolutely right when he talked about practitioners needing to change in the way they practice. System leaders equally have got to change in the way that we lead the system in order to make integration feel real and feel safe for a workforce that have actually felt, in my judgment, quite comfortable in their separate silos. If we want integration to be real in the way that we take forward some of these priorities, which I think are fine. Indeed, I'm one of those chief executives, so I would say that, wouldn't I? But a focus on how our workforce works together in new and different ways is going to be critical. That's what I wanted to say, Councillor. Thank you.
That's excellent. We've got Kate and Councillor Kate Booth and Councillor Matt Bennett. Do either of you want to say a few words, or can I round this off? You don't have to speak, but I'm giving you the opportunity.
Sorry, I'm happy with what the Children's Trust has said with Andy.
Okay, what about yourself, Matt?
Well, actually, I will say something.
Okay.
Wait a second. Trying to get my camera on. Yeah, so I suppose the only thing I'd say is that in reference going back to the West Birmingham question and the sort of structural changes in general, really, it's just a sort of a bugbear of mine that it can be very easy to focus on the structural changes and disappear into sort of the organisational side of it. To people out there, this all means absolutely nothing, and it shouldn't really mean anything. It shouldn't be terribly important how the various commissioning groups are organised or anything. It should be about them getting the best possible services. And sometimes organisations can get themselves and devote a huge amount of energy and time to this structural stuff that ultimately doesn't mean anything to ordinary people. I'm not dismissing the importance of getting it right, but we shouldn't allow a huge amount of time and energy to focus on that at the expense of other more important things.
That's actually quite a good point, Matt. I'm going to say what I planned to say from the beginning. You raised 8 points, Arvia, and they are really key. I am not going to lie. This report is for noting. But the one that I'm really concerned about, and I have to speak as a politician, the one that kept coming back at the doors, it was the issue about waiting times. People that needed to be seen, and they were feeling, especially in wards like mine, that others would be given priority over them. So what work are chief execs doing to ensure that we get a level of equality across the system, and those that truly need this needs intervention, that they're not waiting and it's then becoming too late for them?
Do you want me to come back on that particular point?
You can if you want to, or Paul can come back on it. I'm just telling you what was being said on the doorstep. So that was the question I had. You can leave it and you can put it down as one of the things for the chief execs, but it was something that was a big, all the other things are really important, all of it, COVID, getting out of COVID safety, all of it. But the one that kept coming back was about people and waiting times. How is that going to be addressed? I can leave it, I can take it over to Paul if you want.
I can come in and Paul can kind of elaborate on what I'm about to say. I'll be brief. So you're absolutely right, Councillor, in terms of that approach to sort of tackling our waiting times, and you'll know that there's a substantial backlog that's built up over COVID for a variety of reasons, and you can take an approach where you clinically prioritise these patients and completely ignore the inequalities aspect of it, but we've taken a proactive approach to take account of the index of multiple deprivation into how we are tackling our waiting list. So we're really getting into the sort of detail of not just looking at clinical priority, but taking account of that layer of inequalities into how we are delivering our services, and we're bringing patients in for their treatment. And this is novel for us. I'm not going to lie, we've not done it in this way before, if I'm brutally honest. So it is new to us, but we absolutely recognise the importance of doing that. And we've had really good conversations with Richard Kirby as our system inequalities lead around how you embed inequalities into absolutely everything that we do as a system, and it's in the fabric of the ICS as well, and we do the hearts and minds piece of work around that as well. It's not a separate piece of work. It's absolutely got to be embedded through everything we do. So in presenting those priorities, what we'll be reinforcing is that inequalities thread that runs through all of it. So we are taking it really seriously. We're embedding it into that work. It will be, we'll even have performance indicators around it, so we can keep a really close eye on how we're applying it, and looking at activity data, but also to look at how patients are engaging. So you could put those infrastructures in place, but actually is it actually manifesting itself in the activity that's coming through our services? And so we're going to go to that length really to make sure that we're testing and challenging ourselves, that we're doing everything we can to address inequalities.
Thank you for that, Arvia. In the chat box, we've had Andy come back, and he says it's not just how you get through the backlog, but it's how we support patients who are waiting, and ensuring that we support an offer that looks at inequalities too. I'm just saying to you what he said. I'm going to hand over swiftly over to Paul to round this section off.
I'll be very brief, Chair. Just to say, we are back at levels of waiting that we've not known for a very long time, if at all, to be honest. So I think the first thing is to be honest about the challenge. The second is to say that this is driven primarily by our response of clinical prioritisation as well as inequality. And 5 o'clock, I will join, as I have done most weeks for the last 14 months, the weekly meeting of the medical directors across the system, which includes primary care, where their conversation is entirely about how do we do the best we can with what we have in terms of resources, how do we prioritise patients, how do we constantly review patients and ensure that we minimise harm wherever we possibly can. And then thirdly, to pick up, I think, on what Andy's saying, absolutely right, we're having to start to try to assemble a means of being able to communicate effectively with patients about where they are in terms of their weight position, as it were, but also to be able to hear from those whose situations and circumstances change, and therefore our clinical response to them will need to change as well. And that's an incredibly complex issue when you have got the tens of thousands of people that we have currently on the list. But I can promise you that the absolute heart and mind and focus of those clinical leaders is precisely around that prioritisation piece.
Dr. Munir has slipped in, so I'm going to let you have the last word, and then I will have to move on because time is against us.
I won't slow you down too much, Councillor Hamilton. I just wanted to, and Paul alluded to it there, is sometimes we look at waiting lists as the things that hospitals do, and we don't look at the impact that we've had on primary care. Primary care has been robust, but it is at breaking point. There is lots in the media about general practice having been closed. We have worked fully throughout this pandemic. We've delivered services in a different way, but we've been fully engaged with our patients, and it's been difficult. It's been difficult for us as a society, but it's been difficult for primary and secondary care. We've delivered the largest scale vaccination program we've ever delivered as a country, and we've delivered it very successfully. So it's just a plea to say general practice, the conversation with patients around general practice and access to general practice is also going to need to be part of that wider conversation around waiting lists and the restoration and recovery that we'll have to go through. So I think it's just a plea to recognise that primary care, although we don't scream and shout about how long people are waiting, there is a problem there also.
Right, thank you so much. Now, as you all know, this afternoon, it's only discussion items. So I really thank you for taking part in this. But just to take on board what Dr. Varney has said, we do need you to put in writing any other comments you may have, especially on the piece that Arvinda did, because we want to ensure that as a board, we are feeding back through the Health and Wellbeing Board what you guys actually think. And I lost my train of thought just at that moment, so I'm going to move on to the next item very quickly. Right, the next item is around social prescribing. I'm nearly half an hour behind, so we will catch up at this point. And well, Paul, your name's down for this again, and Pip is also down to speak about social prescribing, and Brian from the voluntary sector, and Stephen Raybould. So if I start with Paul and Pip, and then we move straight over to Stephen Raybould, looking at social prescribing.
If I may, Councillor, I'd rather respond to the voluntary sector first piece because it's their paper, so I'd rather let them go first, if I may.
Okay, Stephen, over to you.
Yeah, it's me to pick it up rather than Brian. Obviously, you've got the document, so I'm not going to go through, and I'm aware we're half an hour behind. It's been and I've talked to Councillor Hamilton about this a couple of times. It's been an emerging issue across the sector. There was a quite substantial meeting involving over 50 organisations of it at the end of last month, looking at the challenges around social prescribing. I mean, there was very broad agreement that it needed to put patient experience at the centre, and that the voluntary sector providers did need to exercise some control in developing and managing effective pathways across their provision, and also that there was a strategic overview taken of the activity. I think there was the broader ask that it be seen in a slightly wider context, that the pathways into the voluntary sector are varied. One of the things that would be of great advantage to certainly to the health service and to primary care is that if people could find their way to voluntary sector activity without having to go through primary care, it will be quicker for citizens, and it will take pressure off primary care as well. There are a number of strategic priorities which are identified in the paper, and some of that is around visibility of services, some of it is around the need for collective planning, and some of it is around resourcing. The three challenges are essentially, to condense it down, are we can't all see what's going on in different parts of the city to get people to the right services, and that applies for citizens as it does to practitioners. The priorities for social prescribing are not always clear, so that we can't necessarily build the capacity that people will need. And then the final thing is about the resourcing. So if there is going to be large scale referrals into the voluntary sector from primary care doesn't need to meet the cost of that, and there are some very well functioning spaces across the city, not least the neighbourhood network provision. But there are other brilliantly functioning spaces, but there may be gaps, and we need to think about how that's addressed within the city. Just to say, by way of closing, we have been organised by COVID, so lots of the social prescribers are involved in engagement in the vaccination challenge and in engaging people across the city. If everything reverts back to the plan as was prior to the COVID crisis, we're quite likely to see a very substantial uptake in referrals into the voluntary sector from the social prescribing structures, and the challenge of how that's going to be met hasn't been developed yet. So happy to leave it there and for Paul to come in and respond.
Right, I've been told, Stephen, that Stephen Connolly from BSOL will be responding for social prescribing. Steve Connolly, over to you.
Hiya. Hi everyone. Thanks for inviting us along. So I thought I'd come along just to see if there was anything that you wanted from a CCG perspective. So my role is the contract management of the social prescribing service within the primary care network DES. So I make sure the PCNs and support the PCNs and make sure that they're doing as they're supposed to, really. As you know, the funding for the primary care network comes through from NHS England through the primary care network DES, and the PCNs have a choice, don't they, as to how many social prescribers they employ. There was a minimum target of 1 per primary care network, so we're very much at the mercy of the primary care networks and how they decide to employ their staff, really, Stephen. I'm not sure I'm answering your question very well, but
just I mean, there are challenges around the employment of the prescribers.
Yeah.
But I think there's a broader challenge around where they're being sent to, because although the prescription that bit has been resourced, the other bit hasn't been resourced, and I don't even think there is a plan around it sufficiently that we can begin to think about how we tackle that.
Sure.
And that's the issue.
I see. My colleague Alan Ferguson is on the call. As you know, the paper that we contributed for the meeting there was 4 of us that gave, we wear 4 very different hats with social prescribing. Alan, can I bring Alan into the conversation? Alan, do you just want to give a brief outline of your involvement with it?
Yes, of course. I'm one of the locality development managers, and my responsibility is to coordinate the social prescribing across the footprint. And I have met with Stephen on a couple of occasions in the past, and I know that it's one of the questions that has cropped up. It's around capacity, it's certainly around signposting, for want of a better phrase, into the right areas. And one of the things I think came out of the meeting that Stephen mentioned earlier on was the agreement that we would start, bearing in mind we've been through this COVID issue, to have a better level of communication across the two areas, so that we could try to sort out some of the potential problems that may come about in the coming months. I know that the providers of the social prescribing via the link workers have also been made aware of this and are aware of it, and they want to have a dialogue that hopefully can bring some sort of not necessarily agreement, because I don't think it's a case of people have fallen out over anything. I just think it's a case of getting a solution that helps the citizens. Would that be a fair comment, Stephen?
Yes, yeah, I do think so. And I think there's general recognition that the approach has been foisted upon the local system by a national approach, and we have to do the best with it that we can, but it doesn't take away the challenge of the risk of a huge number of referrals for where there isn't capacity.
Can I just come back?
Just a minute. Right. So, Alan, you want to come back, and then Robin, you want to come in, and I'm going to ask Maria Gavin to come in to have a bring some of this together with what we're doing with neighbourhood networks. So, Alan, over to you.
Yeah. I just wanted to come back to say I think that unfortunately the pandemic has hijacked a lot of the initial work that we started to do, because one of the key things that came into play at the beginning of 2020 was a joint meeting of the neighbourhood networks and also the newly appointed social prescribers, and that in itself started to bring a sort of a conversation that really contributed to some working within BSOL that we felt would take us forward. But unfortunately, within a month of that meeting, we had the pandemic, and I think we went to virtual working, which didn't really help the situation. So this is a real opportunity for us to revisit where we were nearly 12 months ago and start to build some real plans. Right, thank you for that, Alan. Could we go over to Robin? Have you got any questions, Professor?
Yeah, I have, thank you. Yeah, so thanks all for raising these important issues. And I think we all recognise that the social prescribing as a model was kind of brought in by the centre, although I think we'd agree with the principles, and it's great to see it's better than primary care networks. I think that for me, this is a really good case for the Health and Wellbeing Board asking for a joint commissioning plan across health and social care for how they're going to work together in terms of the way they support voluntary community sector organisations. There's lots of research that shows in the past that voluntary organisations have had to respond to very similar requests from different commissioners by providing different sorts of information, different sorts of contracts, etc. And I'd really like to understand how this is being joined up across the local authority and indeed our health colleagues, so that the voluntary sector, a very simple ask that helps them to build the capacity infrastructure they need, and then they get the financial support that they require to meet the needs of the citizens that they're being prescribed to receive.
Fantastic, Robin. I'm going to bring Maria Gavin in at this point because I somehow knew you were going to say that. So, Maria, over to you.
Okay, hi Robin. Thank you very much, Councillor Hamilton. I think definitely it's an excellent opportunity to pick back up the work that started with neighbourhood networks. Neighbourhood networks have continued to work at pace throughout the pandemic, as you may be aware, adjusting their offer to COVID support. And in fact, during the pandemic, we've moved towards joint work with our voluntary sector organisations for children's services as well, with the ambition to have that all age approach to working with the voluntary sector. There are some good established networks to build upon, and I know we work closely with BVSD yourselves as well. So I think there are some really positive, strong structures with a good sense of local need as well that can be brought together with the social prescribing approach. There are also, as colleagues are aware, a number of platforms. Social Care uses Connect Support. I know many organisations use the waiting room, but I think that integrating the approach and into existing structures which are developing quite strongly is a really good opportunity to pick back up. Was there anything else in particular it'd be helpful to focus on, Councillor Hamilton?
Well, I've got to be honest with you, the point that was raised by Professor Robin Miller regarding doing some joint work to see how you can be more interlinked, which is what you sort of talked about in the chat. I would like you to take it away as perhaps an action you could look at and bring back to the Health and Wellbeing Board at a time that is suitable for us all. I won't give you a time scale now, but something where we can really look at this and the close working. And I know Stephen Raybould really does support this suggestion. I'm not sure who else because I've not tapped in, but I'd like to bring in William Taylor at this point. Dr. Taylor.
Thanks, Councillor. Yeah, I mean, I just wanted to comment on the social prescribing piece. I think we've got a sort of gathering storm in many ways, because what we've done is actually started answering the question that health and well-being is more than just prescribing a medicine or sort of changing someone's blood pressure. It's not actually. It's about the whole person, which is what this board has been saying for a very, very long time. The problem is what you've done then is created an unmet need, and I think that's what Scott has been alluding to, in that actually if there is an unmet need, we need to address that. It's got to be positive, and I would very much support the idea of a sort of a collaborative commissioning structure for this. This is a true cross organisation piece, and certainly something that we should push for our ICS, and a real test for ICS, I suspect, as well, to see if it can be successful.
That's a very good point, Deputy Chair. Very, very good point. Not sure who would take it back, so I'm going to take it back through Paul. Paul, what are your views? Is that possible? It is possible, but can I take it back through yourself as an action?
Yes, Chair, we'll pick that up. And I think I was particularly, as well, if I may say so, impressed by Robin's comment about having a joint way of doing this that makes it all as simple as and as, excuse me, as straightforward for the voluntary sector. I think we often speak with the voluntary sector imagining they have the same level of bureaucratic organisation that we have, and they clearly don't. And we need to find a way to be more straightforward with them. So I'll take both of those actions, Chair.
Okay, that is fantastic. I've only got Will's hand up, so I'm presuming it's a legacy hand. So on that note, unless there's anything else, I am going to move on to the next item. Yeah, great stuff. Right, the next item is creating a healthier city strategy, and I'm going to hand over to Dr. Varney. Justin, over to you.
Thank you, Councillor Hamilton, and I won't go through the slides as they have been published on CMIS and colleagues are aware, but I will just give the highlights. So as colleagues are aware, the board is required as part of the statutory nature of the board to have a health and wellbeing strategy, and we were due to renew it last year, but because of COVID that got deferred. So we're now starting the journey to develop a new strategy for the Health and Wellbeing Board, which its draft title is Creating a Healthier City Strategy. We've based this on the consultation that we've done in 2019 on public health priorities for the city, the feedback and the findings we've had from the various focus groups that we've commissioned, the COVID impact survey that we ran during the first wave, and we're currently running the second wave of the COVID impact survey to further capture more understanding of how COVID and the restrictions have impacted on people's lives. And all of that has been brought together in a strategy which has 10 core themes and then a series of cross-cutting themes which are set out in the slides. We're proposing at the moment the strategy is an 8-year strategy, and that's to really bring us back into line with decades, because it makes it a bit easier when you're cutting data and some of the indicators that are measured in 5-year bands. It would make life a bit easier if we either land on a 5 or on a 10 when it comes to the timeframes of the strategy, but it does give us an 8-year strategy, which is a slightly unusual time frame. We've developed those 10 themes, and we've developed some draft vision statements and principles which are included in the slide deck. And we're now going through a pre-consultation phase, working with the board and its partners and the subgroups of the board, the forums, to further refine those themes, refine the ambitions that sit under those themes, with the aim that then we go to public consultation later in the year. And we did the first stage of that through the board's away day a couple of weeks ago, which was really helpful in further developing our thinking in terms of this strategy. The aim is that we are working towards taking the consultation to the September Cabinet of Council to seek permission to go to public consultation, and in order to do that we'll be taking it through the forums over June and into July, and circulating it through the board ahead of that meeting. That would then give us a consultation period that would run from September into early December, allow us to review the results of the consultation and bring those back to the board and cabinet in mid-January, and then seek final approval for the document in early March, to allow us to then formally launch the new strategy towards the end of April next year. And the timeline is set out in the slide deck that's been put out there, as well as some of the feedback we had from the away day with the board. I'm very grateful for the board's time during that away day and the thought that they put into the feedback through the workshop sessions. And that has already helped us refine the diagrammatic vision of the strategy to really demonstrate the commitment to the cross-cutting principles of inclusion and vulnerability, equality and diversity, and mitigating the legacy of COVID, the foundation of our work across the life course, and then our topic-specific or thematic-specific areas of action, while through all our work focusing on closing the gap. So I'm happy to take any questions, but we thought it was important to bring to the board in public meeting the forward plan for the strategy and the timeline towards public consultation, and our ambition to have a final strategy ready to publish in its completed form for April next year.
Thank you, Justin. Dr. Munir has got his hand up really quickly, so over to you, Dr. Munir.
And I put my camera on quickly as well, so it was a double whammy. Justin, I think this. I was at the development session, and the principles that you've outlined here are really good. One of the first health and wellbeing boards I went to, I think it was Councillor Bennett, said, "How do we get away from strategy fatigue? Because we see a lot of strategies at the health and wellbeing board, and we haven't seen massive improvements in our city over the last 10 years or so." I'm really keen, and I feel like this is a new opportunity, and I think we'll make some really good progress. But how do we keep a check on whether we are making progress, rather than waiting at year 8 and saying, well, this didn't go, either went as well as we wanted it to, or it didn't go quite as well? So how do we get a sense check on a regular basis that things are improving?
Justin, I think that's over to you.
Yeah, so one of the pieces we're doing alongside the work on the strategy is a matrix of indicators that we can track. And what we've been really keen to do is not just look at things that are only measured once a year or only measured once every 3 years. So if you take an indicator like infant mortality, it's published as a 3-year rate and it's only published once a year. But actually, we know about infant deaths through the Child Death Overview Panel in real time. So it's looking at how we can create indicators where we track progress, but also the indicators that are going to take time to change, like childhood obesity, like healthy life expectancy. What are the proxies that we can monitor every year and actually more frequently to move things forward? I have to say, one of the things that was done well by the board back in kind of 2016, 2017 under the previous strategy was they had very clear matrix of data that they were tracking, and that was reported back to the board on a regular basis. And we'd seek to be building on that kind of model moving forward so that we're demonstrating progress as well as having a strategy which pulls all of this together.
Thank you.
And just to add, I absolutely agree with you, Dr. Munir. Sometimes you do get strategy fatigue, but unfortunately, I truly believe that unless you've got some structure somewhere, you don't know what you're measuring against. So you do need the strategy, and I absolutely agree. You need to be very clear on how it will be measured. Otherwise, we get nowhere. But we do need these strategies, because without a vision, we perish. And sometimes these strategies are there to put things in place so we can get to some form of an end point. Does anybody else want to make a final comment before I move on? Will, your hand is up. Did you want to say something?
So my hand's not at my end, but no, I'm fine.
Are you all right? And everybody else is okay. Okay, I shall move on to the next item. I think we may finish a bit early tonight. That's phenomenal. That's unheard of in the Health and Wellbeing Board. Right, the next item is information items only. You will have seen it through the written updates for the local COVID outbreak engagement board. You would have had the forward plans and also the written updates from forums. If you do want any information, please just write in and we will let you know. We've presumed you've read the items and you're happy with what's there. Can I now ask, is there any other business, any other urgent business that anybody wants to raise? No, we've got silence. Right, so the date and time of the next meeting to note is the Health and Wellbeing Board meeting will be on Tuesday, the 27th of July at 3 p.m. I think that one will be held face to face, but we will let you know as soon as possible once the papers start coming in. Can I thank you all for your input? Oh, Andy, your hand is up. Andy Coldrick. Sorry, I was just about to close the meeting, Andy. You just got in there. Andy, go on. What did you want to say?
It was really just to share with the board that the council, the NHS and the Children's Trust are all participating next week in an Ofsted CQC inspection of or revisit, a re-inspection of our services for children with special educational needs and disabilities. So the outcome of that revisit, it may be an issue for this board to consider or pick up some of the themes around, particularly around, I suspect, inequalities that we've touched on today may well be reflected in some of the findings, and it's something that the board should be aware of, and mainly, and we would probably maybe a place that we want to bring the outcome back to. Thank you, Chair.
Okay, well, that will be something that once you've had the report from Ofsted, that will be something that will be organised and arranged before the next meeting. So hopefully, even though it's not on the forward plan, it will be on the agenda. But I do want to, I'm not a great believer in luck, but I do want to wish you all the best for the Ofsted inspection. No inspection is easy, and next week will be a really busy week for all concerned. But saying that, I hope it all goes really well. And on that note, unless there's anybody else that wants to speak about anything that's happening in their area, I'd like to wish you all a pleasant onward tapping of journeys as such to your next meeting online or whatever you're going to do, and a pleasant evening. And we'll call this one to a close. Yep. I shall see you all again on the 21st, I think it was the 20-something of July. You all take care. God bless and good night.
Thank you, Councillor.